Assalamu alaikum. I am Rida Majeed from BS Biotechnology, and my presentation topic is Benzodiazepine Part 2. Benzodiazepine are a class of psychoactive drugs commonly prescribed of their sedative, hypnotic, anxiolytics, anxiety, convalescent and muscle relaxant properties. They are generally safe when used as prescribed under medical supervision. However, like any medication, benzodiazepine can have potential side effects and risk, but they are not typically referred to as chemical infections. Instead, I believe you may be referring to complications or adverse effects associated with benzodiazepine use. Here are a few considerations. Chemical infections of benzodiazepine. Reduce immune function. Long-term use of benzodiazepine may weaken the immune system, making individuals more susceptible to infections. Respiratory infections. Benzodiazepine can cause respiratory depression, which can impair the body's ability to clear respiratory secretions effectively. This can increase the risk of developing respiratory infections such as pneumonia. Chemical infections of benzodiazepine impair judgment. Benzodiazepine can cause sedations and impair cognitive functions, which may lead to poor decision making, including engaging in risky behavior that could result in infections. In injection drug use, although not a direct consequence of benzodiazepine use itself, some individuals may misuse benzodiazepine by injecting them intravascularly along with other substances. This can increase the risk of blood-borne infections such as HIV or hepatitis if proper injection hygienics is not maintained. Mechanism of benzodiazepine. Benzodiazepine are a class of psychoactive drugs that exert the effects by interacting with the gamma aminobutyric acid GBA neurotransmitter system in the brain. They have various therapeutic uses, including sedation, anxiolysis, anxiety reduction, muscle relaxation, properties, and amines effects. The mechanism of action of benzodiazepine involves enhancing the effects of GBA, the major inhibitory neurotransmitter in the central nervous system. GBA binds to specific receptor called GBA receptors, which are found throughout the brain. Mechanism of benzodiazepine. When GBA bind to these receptors, if open chloride channel, allowing chloride ions to flow into the neurons, this influx of negatively charged chloride ions hyperpolarizes the neuron, making it less likely to fire and transmit signals. Benzodiazepines bind to specific site on the GBA receptor known as the benzodiazepine binding site, which is located within the receptor complex. By binding to these sites, benzodiazepine enhance the affinity of GBA for its receptor and increase the frequency of chloride channel opening. This results in an overall increase in the inhibitory effects of GBA in the brain. The increased inhibitions medications mediated by benzodiazepine leads to various effects, including sedation, anxiety reduction, muscle relaxation, and an anti-convulsant activity. These drugs can also cause anemia by impairing the consolidation of short-term memories into long-term memories. Chemical structure of benzodiazepine. Benzodiazepine are a class of psychoactive drugs that have a common chemical structure known as benzodiazepine ring. The benzodiazepine ring is a fused ring system consisting of a benzodiazepine ring fused to a diazepine ring. The diazepine ring is a seven-member ring with two nitrogen atom in positions 1 and 4. The general chemical structure of benzodiazepine can be represented as follow: mathematically copy code benzodiazepine. Chemical structure of benzodiazepine. Side effects of benzodiazepine. Benzodiazepine are a class of psychoactive drugs commonly prescribed to treat anxiety, insomnia, psychosis, and muscle spasms. While they can be effective in managing these conditions, they also come with potential side effects. Here are some common side effects associated with benzodiazepine use: sedation and drowsiness. Benzodiazepine have a calming effect on the central nervous system, which can lead to dizziness and sedation. This effect can impair coordination, concentration. Side effects of benzodiazepine. Motor impairment. Benzodiazepine can affect muscle coordination and motor skills, leading to unsteady gait, reduced balance, and difficulties with fine motor movements. Dependence and withdrawal. Prolonged or excessive use of benzodiazepine can lead to physical and psychological dependence. Abruptly stopping or rapidly reducing the dosage can trigger withdrawal symptoms such as anxiety, insomnia, irritability, restlessness, tremors, and in severe cases. Thank you.